Good afternoon, it's Joyful Hermit. Well, I said I would do this and that next, but I'm going to have to do an interjected kind of a video, because I've had so many thoughts just adapting to, I think I mentioned that some blood test results came in yesterday onto my computer. You get these MyChart things now from your doctors and stuff. And the major markers are coming up for multiple myeloma. And so in researching multiple myeloma, which is a bone marrow cancer, I am finding that part of it is if you've gotten to a certain stage, if it's been lurking along, and since multiple myeloma settles in the spine and causes spine pain, that's how people most recognize it at first. Early on is through back pain. But my arachnoiditis for 39 and a half years, well, the arachnoiditis 36 and a half, but since the accident, my spine is hurt for, it'll be 40 years this August. So constant. So I could tell I had added spine pain this last summer, and the pain doctor increased my pump, which goes in at the around the L2 or L3, but it goes down. And so my upper back, from the thoracic spine and the cervix and the headache and all, it doesn't help that. And it wasn't helping enough of the lumbar and down the legs. So he increased it a couple of times, the pump level, the output, which was very, very, very low. So I have been living actually with far more pain, which is a miraculous, praise to God situation. How even with the low dose oral meds that I take and the pain pump, which is a very low dose, very low output for someone with arachnoiditis, and now also pretty sure I've got multiple myeloma. But the bone marrow biopsy on Tuesday will confirm that for sure. But the main markers from the blood tests that you can tell are there. The only one that isn't real high is calcium in the blood, which I should have more calcium in the blood for this. But like the M spike and the IgG factor in the serum and several others are all multiple myeloma. So I will be highly surprised, maybe even disappointed, if it's not that. Well, if it isn't, it just means I'm going to have all this suffering. But what I found with multiple myeloma is that if you've gone on fairly far with it, you start to have what's called end organ failure, which means organs that you need for your end of your life to get you through fail. And one of them mentioned is kidney, renal failure. The other is intestinal. So, because my intestines are so bad, my pain doctor is going to call in, I think, some injection stuff that I can use. And I have to inject my abdomen to help get it to evacuate when it gets like this, because they're not moving at all, if you can fathom that. And I couldn't before, but I have gained a great empathy and appreciation for what people with probably when the cancer gets into the intestines, or people with Crohn's, or any number of other, well, and the arachnoiditis, so see, that can paralyze the intestines. But from these blood tests, I'm pretty sure that it's the myeloma that has caused the kidneys and has caused the intestines, and likely even caused my thyroid to stop. Because there's no heredity for that in my family or for these other things. I had very good genetics, and other than have some glaucoma in the family, but other than that, no. And so this is making sense. And with arachnoiditis, you don't die from the arachnoiditis. It's always something else. And I also have been, when I get an infection, like a sinus or a cold, it goes into my sinuses, into my lungs. And last year when I got it, I get it usually this time of year, and I'm just praying I don't get it in March. Last year I got it the end of February and into March, and it even into April, and it lasted 10 weeks, or maybe that was the year before last. It was the year before last. I was so sick, and I couldn't throw it off, and I had to have 3 rounds of antibiotics, and after that, even the ENT doctor said, well, you're not even showing this other, you must have an allergy or something, but I was tested, no allergy, so it's just my immune system or something. I think this is what it's looking like. So, I've had these thoughts sort of planning, and I get a little excited, but it also then sort of takes my breath away, just how important. I've not fit into the temporal world, but part of that has been I did not stay the course with who I am and what I am, a hermit and a mystic, and didn't fully accept. I had a hard time accepting. And then when my adult kid sort of dropped off, now the one calls or something. Oh my gosh, I got a chick. She wants me to write something for her. I let that really get to me in a big way. Even though at my spiritual level, I knew God was having them cut off so that I would focus better. They wouldn't be a distraction, that their temporal lives wouldn't be. And they didn't want me as a distraction. And all the suffering and everything, they're burned out from it. So but it still got to me, my ego, the id. The ego in us is stronger than what we think. At least in me, it was. I'm more attached than what I think, as far as when it got down to the 3 people who mean the most, or were the ones that I gave birth to, and their souls were the ones that God ordained for me to bring into this life. So I've had these thoughts and just trying to busy around getting some stuff done. And but Dr. H called, and I had texted him and said, this is looking what it might be. And he wants to go through all these things. And I had already decided this morning, because this other lady, a neighbor woman, different neighbor woman, older woman, well, I'll write to you tomorrow about all these things. And I said, well, I'm not going to get into, I can't take the time for people who want to, in a way, sort of argue a little or debate, or because their perception is, oh, how sad, or it's going to really affect me to be leaving. And they haven't known me even when I have explained these things. They don't know me, they don't grasp me, and they cannot. It's just another level of, like the lady who glummed on, who couldn't get it, what having a friend as a hermit or a mystic would be like. Not a good friend if you want a temporal friend or social or chit-chat. And what it did to me then in my trying to get into her level, or sunk down with it, not that her level was a sunk down, but for me it was, to leave the spiritual and to try to relate with something temporal, I got into my same old upset, or what could I talk about? Well, my adult kids and how that relationship is altered, or my suffering or my pain. And that just, so you have it. But I would try to write then of the spiritual aspects of suffering, or things that I thought she would need with her bad lungs and going to face dying soon, anytime really. So, but no, it lowers me, and it sucked energy out of me in time. And the same thing will be and I'm telling you guys this, so you don't need to leave comments or try to ask me questions or get engaged in feeling like you have to prepare me for anything, or well, or oh no, it might not be that. Well, if it's not that, then I'm going to have this horrific suffering that I'm in. The intestine thing is really a life-altering, quality of life major factor. And the added pain I have, the kidney problems, they're not working right. And so it's even if it's just that, it's going to be rough. But I do have all these other symptoms that are multiple myeloma symptoms, including, but I have neuropathy down in my feet, like, and at night it's like every night it's just worse. I keep waking up just to have my feet touching. I have my feet elevated, touching a pillow, the sheets. It's just agonizing pain, and that's foot pain, and ankle pain is big with multiple myeloma as it advances. So I'm being realistic about it, but I decided I want to live these last months, or whatever, it might be a year, if it's advanced with the kidneys and the intestines, they say. And if it's a certain kind that they identified, a kappa chain in these blood tests can identify a lot of it in that. Kappa chain and my IgG factor serum. That the kappa IgG is more aggressive. So it may mention 12 months or something like that, depending. It all depends on people and on God. What God wants. But I thought, even though I should have been doing more before, and I've mentioned about a year ago, I really went into a major slump, a spiritual slump. My thyroid had gone out, which might have been from this multiple myeloma also. It can affect your thyroid. So I think I mentioned that. But it's just sort of nice to have some answers. But I won't know for sure until after the biopsy on Tuesday. And then I meet with this oncologist on March 3rd. And if it's nothing, or if it's lupus or something, then I'll go to a rheumatologist. But none of the blood test markers that came back yesterday were connected with lupus. So it's all multiple myeloma. So, and multiple myeloma can start from being on non-steroid blood thinners, which meloxicam, Mobic, which is what they give arachnoiditis people or anyone with lots of pain. They automatically put you on that rather than the dread opioids. The opioids would be much healthier. It's a known problem, meloxicam is. It does damage to liver and to different organs, and I read it's a cause of myeloma. So I would have been better off years ago just being given the opioids to help the pain rather than this medicine. Mobic is the trade name for the base name, whatever they call it, Mobic, but my brand was meloxicam. Then putting your body at risk with that known risk, because opioids for someone with severe pain does not affect your mind or any of your organs. It can cause constipation, but you deal with it with diet and exercise. And I used to be able to take Miralax. I can't now. It's bad for kidneys. Can't do prune juice or raisin bran, bad for kidneys. So anyway, that's a situation. But Dr. H even went, now just wait, and he wanted to see if it was connected to the COVID injections. I said no. I said it isn't from that. And you just get into these things, and I'm just not going to waste time on it. And he says, now you said that you'll be disappointed if it's not myeloma. He says, now tell me why. Well, of course, he's a psychologist, and that's how he thinks and talks. And I like it. It's fine. But I said, because I had remember the death experience. He knew me back then. I mean, I was there physically in his town. And he would come over, and I told him about the death experience. And the others, and I said, it's so glorious. And I also said, and you know very well, I don't belong to the temporal world. I haven't fit in, and I haven't done a good job of sticking with my vocation and my spiritual. And I said, only recently did I start doing these videos more seriously, steadily. And I said, I have found a small niche, a niche that is worthwhile with like-minded people and other mystics and other people who suffer, and whatever reason you watch these. And then your comments really help me learn and grow and help keep me more focused. So it's been a very positive. It's like there has been more purpose and reason and a little cyberspace niche for me that has been very positive and lovely. Thank you. Thank you very much. But reading has been difficult because my pain level and the arachnoiditis and the thyroid, that I was so exhausted from that. And so I'm ready. I do have regret. You can't really hold on to any regrets though. But God knows, see, I didn't pay heed to the nudges and even the written note from my spiritual dad before he died of what he hoped I would be doing, get back to my reading and writing. And instead, I started doing my manual labor, which is great. It's good exercise and helps your body. But I just immediately started having surgeries. And so that's how life is. But I think God knew that, we have to die of something. But I wasn't plugged in with all three prongs in the socket myself, because I keep getting, even to do the manual labor here, you have to go get the supplies, and then there's problems, or there's something you have to take back, or something doesn't work right, or then I needed help, and then that gets off into the temporal. And while some of the temporal's good, and I do feel that, like with the handyman, that my prayers and my time with me was not insignificant with him or for me, because I understand him well, and I have great empathy and concern for him, and lots of prayers. But that also then was, I guess my time hasn't been in just enjoying this. I have way too much suffering to really enjoy all of this. But I explained to him, I said, no, I said, if not for the suffering alone of just that I'm a misfit I was thinking of this school principal and all of that I went through in having to get rid of him for what he was, a fraud, and all the trouble I got into with priests, and the bishop was upset, but they were grateful that I pointed it out. I finally had to write to the bishop, and then I had these two priests in my hometown all up in arms against me, three of them actually. But he was bad person. He was a fraud, and he had started to be inappropriate with the 8th grade girls. And anyway, it was another assignment I had of dealing with this school principal, this Catholic school principal, who didn't even have an administrative license. He was a total fraud, and he was bad news, and it was mothers who came to me. I got a reputation. They knew that I would do something about stuff, so they'd come to me to report what he was doing with these 8th grade girls. He didn't molest them physically, but he was being awful making them very uncomfortable and getting them in his office and just toying with them sexually, like mental or words things he would say to them and make them very uncomfortable. He got his jollies that way. So, just enough, And I know I'm going to have consequences for how I didn't even keep my 9S's real clearly laid out. So I decided this morning that whatever time I have left, I want to live like the hermit and mystic I am and die like the hermit and mystic I am, with my 9S's close by, my Bible, and with any assignments God gives me at this tail end of my life, I will throw my heart and soul into. But I decided I am not going to tell people. The people who needed to drop me off in life, who could not grasp and could not fathom how God made me, I'm not going to spend the time and energy. So if they don't know I'm ill and dying, which I think I am, we'll find out again, but I mean, I am at some point, and if not, then this will be a good trajectory for me for the rest of whatever, 3 years, 4 years, whatever. Because with arachnoiditis, you don't live that long either. You have a shorter life expectancy. But I had to make these decisions this morning of not going to get involved with conversations of people who want to try to alter my view of letting go and dying, because it'll be exhausting. It'll just be more of the being over-peopled again, because people can't grasp. And Dr. H, he started to laugh. He says, I know. He says, you have an outlook unlike most others regarding dying, being sick and dying. And because people want to keep you here. They want to keep you. Now, my kids won't, but I'll have to deal with that situation. Can the one who wants my house, does she have it in her to really cope with someone with intestinal issues? It gets foul. It already has. Had PT this morning, and I said, look out. I said, feel free to leave the room. It's a putrid odor. And even just a little goes a long ways. And he says, he says, well, I will. He says, we've got this real strong air purifier. Turn that on full blast. And I'm not even in a bad time right now, but I don't think my one of the adult daughters she's squeamish. She couldn't handle that kind of thing, intestinal stuff. I don't think so. We'll have to be realistic about that. I mean, getting a good deal on this house would have to include being tended. It was, to avoid spending I wouldn't have the money for a nursing home. So that's why I have to sell this place, get it finished and sell it, which I can get it finished with help or myself working also. And as I'm going to continue on, I decided with my regular routine with my manual labor, which isn't a lot because of my health right now, but it's something. And but no, I just said there's no sense in getting into debates with people about also what caused it. I'm not opposed to those COVID injections. Some people get really gonzo on them. You don't have to take them. Don't take them. I took 2. I stopped. Just decided, didn't care anymore about, I didn't want to get it at first. I got one, and I didn't want to spread it to anyone, so I Then we were told we would get a second one, and I did. I had no reactions. But some people are just convinced it's the end of your life. Well, with me, you're talking to a person, it's okay. I don't get into all this political stuff. So Dr. H stopped. He stopped with that. You know, if someone's doing serious research about it, and I want to be in their research study of does a COVID shot cause multiple myeloma, fine, I'm not in the study. I don't want to be. My attitude is don't take the injection if you're worried about them. And people don't, but my handyman likes to get into that kind of stuff. You know, if I forget what else. Oh, was, want to argue that my kidney problems came from that. No, it didn't. So see what I mean? I am learning. I am learning to discern and to nip these things in the bud that I discern are not going to further my spiritual mission and purpose, or my own prayer life, or my love of God. The temporal is passing away. That's probably going to become one of my mottos. God provides and the temporal is passing away, and just adore him. So that was one of my mottos. That came from the Virgin Mary. I was at a weekend retreat in this first parish, and maybe I mentioned it. I was asked to give a talk. Well, lots of people give these talks. It was Christ Renews Parish, a women's retreat. Shouldn't have done it. It wasn't for someone like me, I don't think. But it was before I was a hermit. But I went. I prepared a talk. I gave the talk, but there was a boycott of my talk. Even that was blown up out of proportion. I talked about the spiritual life and of fitting in or of not fitting in. We were supposed to talk something about ourselves and growing up and things. And I wrote about how I never felt like I fit in. That was always a thing. And then by adulthood, I was realizing after my divorce that I didn't fit in. And then when I became Catholic and had a label that was more authenticated, mystic, that I could understand, I had read of the mystics and thought these are my people, but to have different priests tell me, yes, this is what you are. And then for my spiritual da, who was 80 something at the time, then say, and I've never met anyone like you in all my years as a priest. But it's you're good, you're wonderful, don't worry about it, but you're very different, and I've never met anyone like you. That freaked me out. And I said, I don't want to be said I'm different. Don't say that word. And he says, you've got to get used to it, accept. And it's a good kind of different. You're a good person, but still it was hard. But that gave me an understanding of why I never fit in. And it's not going to happen now either. My perspective is not going to be, and my way out isn't going to be spent trying to help other people help me accept it. See what I mean? How it can get. And then I feel sorry, and I want to... I was a people pleaser. I was the youngest that had an alcoholic father. So I learned to please and to try to keep the peace with factors in the family. My oldest sister bucked the parents, eldest kids, and if you study sibling order, it can happen like that. My mother had a temper. My middle sister had her own way of retrieving or dealing with it, retreating, and then I tried to be the pleaser and to keep my mom from being upset and please my dad, because I was the third daughter and I was, I probably wanted a son. Of course they did. They named me close to his name. So, anyway, that's part of what I'm planning for this last time period of, I mean, I'm going to die of something anyway, and if it's going to be this horrible suffering with my intestines and the kidney stuff and my arachnoiditis pain and this pain worsening in my feet and all, not sleeping at night much because, well, that goes with multiple myeloma. I'll just call it MM. That's what they say, MM, multiple myeloma. But if not, I still have to deal with all of that if I eke out 3 or 4 years. But I want to get very focused on those people who do have spiritual need and want prayer, and of myself discerning properly and rightly. At least I don't think I'll make the mistake again of thinking I can be relative and of any much use to a temporalite. And I'm not saying temporalite it's like the Israelites, it's a temporalite. It's a group, a category of people who are God placed on the earth chose them for the temporal life. And that's their place. And that's why this woman I gotten involved with friendship, chatting all day was with messages or whatever of just temporal, to me, superficial things, but not to them. It's not to them at all. And they are very loving. Her kids love her. And their friends are all, that's their reference point. And it's alien to me. I don't grasp that any more than they grasp me. So that's why I'm not going to tell people, because if they couldn't grasp me then, they're not going to grasp me now. And there's no sense in dealing with all of that. And even my own sister with her own anxiety disorder and her depression, and she can't handle her lymphoma well. Well, she does through God, thanks be to God. But it's a major hardship and difficult. And 3 or 4 years ago, I guess it's been 4 that she's had it, 3.5, I asked God, please let me have that and you heal her. Because it's hard for her to cope with that. And her husband, she's pretty much stays in for fear of getting illnesses and all of that, and which I don't blame her, but it's the anxiety attacks she has when she had to have the chemo. She's been in remission. She's really her immune system is low, so she has infusions that are increasing her antibodies. It's great. But she gets very anxiety-ridden when she has those infusions, plus they make her feel ill. And she used to have terrible shakes from them, I think from the anxiety after or something. I don't know, or it could be from how it affects her body. I don't know, but at first she had mentioned it made her very anxious. And she can't help it. She's got body chemistry, brain chemistry out of whack, hormones, her brain chemistry and hormones have caused her this. She probably was a childhood depressant, melancholy and all. So, and back then, people didn't know. And so as an adult then, she's gotten all these tests and she's in an area with excellent medical care. And I have an excellent oncologist here who's right on top of things. Boom, boom, boom. And finally, so I know when God wanted something to happen, God made it happen. And when I asked, I want to see myself as I really am, he's including the physical. He's giving me answers now. Thank you, Lord. But, so anyway, let's keep the videos and the discussion. I'll try to get off this, but I'm just explaining in the comments section, not on going over oh, well, you might live, longer, whatever. It could be this or it could be that. Not that. Let's just not go there with it. I'm pretty sure this is what it is. If not, um, it's an anomaly, that's for sure. Every single thing that's out of whack on my blood test so far, when you put in that and multiple myeloma, that's a direct correlation. And when you look up markers for multiple myeloma, then it says high M spike and IgG and kappa. Kappa with IgG is more aggressive. So it's all coming together. And that excites me. I've always loved mysteries from when I was like kindergarten, first grade, reading on. And watching them now, I like to have that the mystery solved. So anyway, this is my plan. I'm talking it over with you guys. And ironically, this woman didn't write to me today. I really put my foot down. A different woman, a very lovely woman, spiritual woman. But she's having a terrible time with her son, who's of an age that, yes, death would come. Okay, he's 63, and she's 85, and he's got advanced COPD, but she's having a terrible time dealing with his illness and passing, and is upset and all by it, and having a hard time dealing with it. So her perspective's different than mine. And yes, I would be upset if any of my children were sick and dying, but my perspective is warped. It's warped because of my death experience. I just view it differently. And the Catherine of Genoa talks we had, and reading that really set me on fire, prepared me for the excitement of the progression continuing. And even though a year ago when I really flopped spiritually, and I even told Jesus, that I'm done, I'm tired, I can't do anything more spiritually, I'm just gonna waste time on this mindless stuff I can look at, and it puts me to sleep. I didn't even have I was so exhausted with the thyroid going, didn't even have the mind to watch a mystery or a film, a movie, a good movie, to take my mind off of pain and things. I just needed something that I could just doze off to, and was a relief or relaxing or sort of cathartic visually. And it was just sort of just dumb stuff, just stuff that was mindless. And it didn't elevate me spiritually. I did pray for different people that, I would watch, or different situations, but I knew I wasn't doing right. And I told Jesus, I said, I'm sorry. I said, I'm just waiting here for you to come get me and take me with you. I'm so worn out, so worn out. But I'm rejuvenated now and really on focus with the spiritual, but it's just going to continue on. But I told him, I said, I know I'll have consequences, and I'm willing to take the consequences if I'm in purgatory forever or in progression forever, for the end of time, and never come to consummation or full union with you. I just am that tired. So, but here we are doing better spiritually, definitely thanks to you all and the videos. It sort of keeps me focused. And when Dr. H was talking to me, I said, well, so much of it comes back to discernment, where I went off in different periods of my life. If I were going to get sucked into regrets, it's that I lack discernment. That's why I'm going to continue with John Climakis in this section on discernment, because it's invaluable. It's invaluable. And that's why he has it is within the last, it's the fourth to last step of the ladder of divine ascent. And so it will help me, I think, the more I know now, that I can learn now even, of things I lack, will help me when I'm on the other side and progressing. So that's what the Holy Spirit told Catherine of Genoa to do all you can now to prepare and to progress now. And part of that for me is going to utilize what is a gift of the Holy Spirit, knowledge, is to build up some knowledge. Even though, yes, I will have knowledge, I will learn on the other side. But since I've run into this now, of how weak I am in discernment, proper discernment, and to make then wise decisions that also would be loving decisions for the other people. That's why I have a couple of friends who got offended by me because I finally said some things, or they knew that I saw one had a real problem and needed some help, and I knew wouldn't get it. And this was after years. I finally saw how severe it had gotten, and it was like a fraternal correction kind of thing. But the person didn't take it well and totally cut me off. It's a relative after 32 years of being like sisters, very close. But I also could see that God wanted me to himself more. And all of my counseling and coaching and trying to help her with a problem that she had and would talk to me about. But when it got to a point it was too much, I said, you really need therapy to get onto this, to get this. And it's something you really want to get handled before you pass away, or before your mother passes away. To get this anger of your mother out that's been there since she admitted since she was 3 or 4 years old. Hatred. Got down to hate. She'd say she hated the person. So, and the mother didn't deserve that. A lovely person, idiosyncrasies like all of us. But so that person cut up. But I'm not going to tell people because I don't want to invite all that back in. I have to stay focused. And I'll pray about it. I'll keep praying about it, but I'm going to keep very quiet about this amongst anyone that would happen to know me, because then you can get deluged by people, just like the lady last night who was texting and says, well, I'm going to write to you tomorrow about all this, because I told her I think that I have this, and getting some answers, and that this will be good, and I've got to really pray and get things in order as far as spiritual life and also physically. Get things handled, which is responsible to do, rather than to leave everything for other people who are chosen for the temporal life and have very demanding. All 3 of my kids have very demanding careers and families they have, which is their priority, their first priority too. It's their families, their children, and then their careers on top of it. So it's an act of charity on our part, is to handle ourselves. But I'm going to not say anything to them for a while too. But I will tell my kids, because maybe not the son, something big has got to shake him. And I think it's going to have to be something that he'll really have some regret, that will maybe shake him back to God. I don't know. I'll pray about that. But I think we'll just wait. I just get this sense, wait. Of course, wait to make sure that this is what it is and have more of an idea of how long, because they can project pretty well with myeloma. A lot of people get it. But this one chain and the kappa IgG is not as frequent. But we'll see what the oncologist says after he's got all the info. But I do want to keep the focus, though, of the I'll talk about this from time to time as a process related to spiritual and how I'm going to handle it with people, with keeping love of others in mind. But the people who were frustrated me in life and couldn't grasp me and would say, we have a hard time even being around you or something like that. When I make comments like that, then no sense in inviting in, not physically in, but into the discussion or explain over and over to people. I did read as far as treatments that the main reason, if you're far enough along, that you would take anything, it's to handle the symptoms, to help tamp down the painful symptoms. That the medications can help with that part. So it's more of a palliative care of just making you as comfortable as possible and coping with your end organ failures. So I would probably do that, but it's not for the purpose of prolonging life. For me, anyway. And yes, I will admit there's disappointment. I mean, there's things I love life. There's, like the paint store yesterday. I got the new colors for 2024. I just love colors. But from everything I hear from people who went further than me and have it, the colors, the light, it's, nothing really to cling to here. But I've enjoyed I love to paint walls and I love anything I do, I love. I've always been blessed with that whatever I undertake, I do it and love it. And so, except eating sardines, but I learned to like sushi. Now I can't because there's, too much things in avocado often and kidney diet. But yeah, so I think this is good. And then I just want you guys to be assured and, don't worry for me and don't take on the burden of, trying to work it through with me. I'm worked through, in other words. The Holy Spirit will help me, my guardian angel, and I've nearly died several times, so it's not that, it's suffering that's going to be the hard part. But and then also dealing with my neighbor. She's already do you think it's cancer? She'll be nice, but she's the one that wants her son to buy this house, and he's not going to. My daughter wants it, and I'll do all to make that possible for her. But she's going to have to understand that part of it was she was going to be in here, and if she can't cope and she's squeamish, then it's not the right situation for her then to think she's going to buy it, because it will make it unequitable for the other to have a lesser inheritance. It's going to have to be even, and she would owe so much to the other, and it will be at a fair price. I'll take off a realtor fee, obviously, but a house in the area went for a lot, but more than what I thought it would, or this area would, because I'm not in the high area of this town by any means. I'm in sort of the average low, and and it's a stretch. I have a huge mortgage, but see, she wants to take on that mortgage, which she can because my house is in trust. So, and she could get the low rate. That's why she can't get a place of much of anything because interest rates are high. Anyway, all these details, these temporal things, but it's all part of this situation, and we'll get there. God bless His real presence in us, and I'm sorry I got onto this. This is sort of ridiculous talk. Temporal chit-chat. I'm sorry.